So good afternoon, I'm Ilaria Cutica. I'm a psychologist and a psychotherapist and a professor at the University of Milan, where I work in the Department of Oncology and Hemato-oncology. And today I would like to talk with you about the psychological aspects of gene therapy and about what psychologists can do and how they can help in taking a decision about having or not gene therapy. One of the most relevant things for persons with hemophilia to address is the importance of deeply reflecting before deciding whether gene therapy is the right choice for them. And so, what can psychologists do? First, they should help patients to consider their motivation. Why might they choose this treatment? Patients may have a range of reasons for considering it. For many, the motivations arises from a desire to reduce the burden of current treatments. Traditional therapies often requires frequent infusions or lifestyle adjustments. And gene therapy offers the promise of a greater freedom, potentially eliminating the need for regular infusions and allowing individuals to live with fewer restrictions. But other patients are already satisfied with their treatment and are driven by different goals related to an improvement of their quality of life or a life with an hemophilia-free mindset. So they may hope to engage in more physical activities or simply that is a lot actually, feel safer in situations where previously they were worried about. So, however, any is the motivation, it is important first to identify it and then that it is aligned with the realities of gene therapy. So to this aim, to help patients reflect about their motivation, there are also some decision-making tools that encourage patients to reflect, to ask themselves questions like, is gene therapy the right fit for my life goals? And these tools may be used by the patients alone, and then the answer that the patients gives can be discussed with a psychologist or with healthcare professionals, and it helps to clarify one's mind about it. And another key point that is worth discussing with psychologists before having in the process, in the path of decision making is patients' expectations about gene therapy, because expectations play a crucial role in decision-making process, and many patients, for instance, are excited about the potential for reduced bleeding episodes, for improved joint health, but it's equally important that they have realistic expectations again. And so this is why it is important that patients they feel free to ask for whatever they feel relevant to know. They should feel completely comfortable with their understanding of gene therapy. This is another point that, of course, they have to discuss with the medical staff, but they can be encouraged to do it. And it can be underlined how much is it important that they know that they have not only a superficial knowledge of gene therapy, but to make a real informed decision, it's important that they know gene therapy deeply, that they know how it works, that they know well all the potential side effects to take a really informed decision. And another thing that patients might discuss with the psychologists more above expectations are the concerns. because alongside these hopes that we already said, there are also several concerns. Some patients are worried that their clotting factor levels might decrease, or that they might eventually need to return to traditional treatments. Others are concerned about potential side effects, or such as increased liver enzymes or immune responses, or other long-term risks. And although these risks are rare and can be closely monitored, they are still important for patients to consider. They have to balance pro and cons of their decision basing on what is most important to them. So the key role of the psychologist is to help decide what is more important for me.